the issue which comes is that everybody knows that a bad lifestyle, cholesterol, diabetes, so many things are responsible for this particular disease. But the when it comes to prevention, many times we see videos and sessions where we actually go into quick solutions like drink this, take that, eat some fruits, take some vitamin C, take something like this, and you will never have a heart attack. So is it possible that the most common cause of death throughout the world can be mitigated with some silly or simple tricks? So we will understand how heart disease happens today and how it actually needs to be prevented, right? So first, the basic, everybody knows that there are blockages which form, and these blockages are formed by your your body inflammatory process, and they are basically a mixture of cholesterol and platelets and other things. So today there are this, because see what happens, we have learned whatever we have learned about human body through various um, years of research, and there are evidences to support all these hypotheses. So we'll be deciphering that. Okay, let's understand this thing which we call as atherosclerotic cardiovascular disease, ASCVD, and we want to prevent it. This cannot be prevented alone. How, why this is said, team based approach is very much recommended for the control of the risk factors. Now that is very important, that will I get a heart attack in the near future, in the next 10 years or 20 years? This assessment is done on the basis of what risk factors you have, and you need to have a team of people in your house, and as a clinician or a medical professional also should be there in the team to help you decipher what risk factors are the most critical, which and how to mitigate those risk factors. And this decision you have to make on the basis of what is comfortable to you, because sometimes some things are not comfortable to you. Maybe you are not getting time to sleep properly or eat properly, exercise, and your doctor is saying you need to exercise, you don't get excess time to exercise, and then the things are just like that. So a shared decision needs to be done, and it's very important to be around people who have that kind of a healthy attitude, and socially you have to be around people, and it's very important to treat the risk factors not just in yourself, in your surrounding, or else people who are usually in drinking habits or smoking habits tend to do that regularly if they don't leave that social circle. So let's clear and understand uh, what are the most important determinants, social or physical or self determinants, which actually lead to uh, heart attack, and what you need to do. Okay, so the most important thing here is the cardiovascular risk. You have the diet, exercise, and your body weight, which is the key factors here. Okay, so you cannot prevent by just taking one extra thing in your diet. You have to correct your diet. So the main principle is diet modification. Okay, that, and including your what you need to add into your diet, what you need to subtract into your diet from your diet, whatever you are doing wrong, right, that needs to be addressed, and first you need to accept that. In order to understand this, there is a level of health literacy which needs to be there in the people, right? We need to educate ourselves that what are the baseline causes of heart attack and how we can go through it, so we can actually start with the most detrimental risk factor which is present in my particular or your particular case. So diet is a very huge factor, and the barrier where a heart healthy diet is not followed is because of the presence of two things. One is either there are economic, socio-economic factors, good amount of food or good quality of food is not available, and the second is because the knowledge that what you are eating, the processed food, amount of processed food which you are eating, easily available food you are eating, which we basically say junk food, or something which is fast food, which we are eating, is increasing day by day, because we are concentrating more um, on our work, on our studies, on our work, on our social life, rather than on our diet, right? So it's very important to educate ourselves that what is healthy, what is not. And first step is to remove the unhealthy. Okay, so you cannot add good amount of good water and then add dirty water in a glass and think that I have added good water, now I can drink this. No, you have to remove the dirty water or filter the water, remove the dirt, and then you can drink it. So it's important to remove the bad habits first. The second thing is to address your important of exercise, right? It's very important that you and your social circle, your surrounding, your family has a habit to do physical activity. And that is bare, that should not be a bare minimum, but there is a bare minimum amount which is recommended. But you need to have a good amount of physical activity in your life, and over the time, over a period of time, you have to try to increase it. If you are obese, then you have to work on your weight. Not just weight, obesity can affect your sleep, right? That you can have some sleep apnea, which can actually increase the amount of cortisol and stress hormones in your body, and over time this can lead to heart diseases, higher inflammation, diabetes, many other complications. So obesity can also lead to psychosocial stress, people calling you with names and other thing. You are not confident. There can be individualized barriers, that you get urges to eat and you eat a lot of cookies or ice creams or things like that, sweets. So you need to address what is my, and you know by yourself, everybody knows what is my main issue. Why am I not losing weight? Why am I not exercising? Am I lazy? Am I weak? Am I deficient in something? Am I having some kind of disease? Is it a psychological disease? Is it a physical disease? And the most important question you have to ask, are you ignoring yourself? Because sometimes you yourself are not able to solve the issue, then you have to take help from your family or your doctor, your healthcare provider. It's very important for your doctor to understand, pinpoint, and tell you possible solutions. And at least you have to start with the solution which you are able to stick with. You cannot start with a diet or an exercise routine or pay for the gym for 1 year and not go to the gym. So, this is not going to solve your issue. Okay, but a small step ahead every single day, small thing which you can do every day, will definitely help. So, then the real risk factors which we can say is diabetes, high blood pressure, tobacco, obesity. Obesity is there, lack of exercise and bad diet is there. These are the major things, right? So diabetes is insulin resistance. This can be again a very critical factor which leads to other side effects, including people might have depression, which can have many other things which are related to diabetes, higher amount of inflammation. You can have neuropathy, vasculopathy, diabetic renal disease, kidney disease. A lot of things can happen because of uncontrolled diabetes. So you have to address if you have diabetes. Then blood pressure. So blood pressure, even if it is very, everybody gets high blood pressure when we are running, when we are exercising, lifting heavier weights, our blood pressure rises. Everybody who is running up the stairs or jumping, kids are playing, you play sports, at that time your blood pressure rises. That's normal. So first concept, we need to understand that high blood pressure is not the issue, right? Even the highest 180 or 200 systolic blood pressure by 100 110 diastolic blood pressure is not an issue. The issue is for how long it stays there. That is the issue. Okay, for how long your blood pressure remains high. Is your body, I mean, the body has a natural tendency to detect that the pressure inside your blood vessel is high, and it basically relaxes your blood vessels to reduce the pressure. So if this capacity inside your body to do vasodilation and reduce the blood pressure reduces with age, with smoking, with obesity, with other things. So if this capacity of reducing your blood pressure by yourself slows down and your blood pressure instead of coming down within minutes, within 10 minutes, within 5 minutes, within 2 minutes, stays high for 2 hours, for 4 hours, for 6 hours, then that higher amount of pressure is there inside your arteries on an average over a week, over months, over years. And that increased amount of pressure will cause inflammation inside the blood vessels. And that is very big factor where inflammation happens. And if this patient is also diabetic, also obese, also smoking, also has high cholesterol, then you have a disease problem. Okay, so things are very, there are things at a very subtle level, very small invisible level, where you need to understand why you need to check your blood pressure daily or regularly, and why you need to check it at a resting state, and you need to recheck it. Right, just saying that okay, take low sodium diet is not enough. Okay, because oh yes, for a healthy, to reduce blood pressure, you need to take less amount of sodium. That doesn't mean the salt which you add at home while cooking. That means the extra salt which you are taking from outside, the foods, the chips, the fries, the things which you eat from outside are filled with either high sugar, high salt, high oil. Those are the three things, sometimes all of them. So, reducing your packaged food, processed food, outside food, junk food is helping you lose weight, control diabetes, control blood pressure. And then exercise. Why exercise? Because exercise actually gives practice to your blood vessels to relax. The more you exercise, the regularly you exercise, your blood vessels relax. Okay, your blood vessels secrete, endothelial lining secrete nitric oxide, and it relaxes. Right, that's why people say okay, you need nitric oxide, so let's take uh, things like some kind of fruits or vegetable which basically has a little bit of nitric oxide, but that cannot mitigate, or that cannot replace the importance of exercise or the importance of good amount of sleep. Right, because rest is also important. If somebody is always stressed, worried, what is going to happen, what is going to happen, his blood pressure will be slightly high, his heart rate will be high. So you need to learn how to relax your body by deep breathing, by yoga, by meditation, whatever you feel like, whatever makes you relax, right? And then the other part is exercise. Then the other part is checking, monitoring your blood pressure. And this is just one big factor. Blood pressure is called silent killer. You know why it is called silent? Because until there is damage to your end organs, you never knew, you never get a symptom of higher blood pressure. So you need to check. When do you need to check? If you are above 30 or not exercising regularly, getting obese at any age. If you're obese, you have an obese child, 15-year-old obese child, 10-year-old obese child, right? Check his blood pressure. Okay, so regularly. Then we have tobacco. Okay, tobacco is something which is a social problem. Social problem. So nobody starts doing it by himself or alone. Maximum it starts socially, and there are peer pressures and social pressures normally, and then you get addicted because of that. And then that tobacco, which has like 7,000 chemicals, and out of them hundreds and thousands of carcinogens and inflammatory substances which goes in your lungs, many of them go in your blood, and at the same time your blood pressure is high. Maybe you have diabetes, maybe you're obese, and you're not exercising, and those things are causing your veins, your arteries to get again, you know they narrow down, they cram down, and they try not to open. They do try to resist these toxins, but then that can have side effects like high blood pressure. That can have side effects over time. Right? They don't know that you're going to inhale or take that tobacco every day for the next so many years. They think it's the last time, but that doesn't happen usually. So you have to stop this habit of taking whatever type of smoke or tobacco you are take. Then let's talk about uh, assessment. Who needs assessment for cardiovascular risk? Right. So these were which we just saw. These are the risk factors. Okay, the cardiovascular risk factors. Um, this diet, exercise, obesity, weight, diabetes, high blood pressure, tobacco, and even a little bit of alcohol. And now sleep is added to this. Lack of sleep is also there. Um, it's not really a lack of some nutrient. Okay, there is no lack of nutrient which is causing this. Not even the cholesterol levels is there right now, because high cholesterol doesn't actually mean you're going to have a heart attack, but it just means that if you have these things not in control, that higher cholesterol will lead to easier development of these clots, or we can say atherosclerosis. So yes, cholesterol is a factor, not the most important one, not the key factor. Key factor are all these. Okay, let's talk about who needs cardiovascular assessment. Okay, so there are some methods which we can calculate your 10 years risk of having a heart attack, or 10 years risk of dying from a heart attack. That is also very important, because people, you need to understand, everybody will get wrinkles after a certain age. Everybody will uh, die at a certain age, but your risk of dying in the next 10 years can be assessed. Your risk of wrinkles are something which happen because of age, and because your body stops regenerating, okay, after a certain age. Same goes with your arteries. Your arteries can also heal, they can form new arteries up to a certain age, then they stop. Then whatever blockages, and blockages are a part of life, they actually develop over after a certain age, just like wrinkles. So the more amount of uh, bad things you do in your lifestyle, the higher number of blockages you will have at a lesser amount of age. So that's the case. So on an average, if we think a 40 year of at 40 years of age, you should go through a assessment, cardiovascular risk assessment, for everybody. But if you have some kind of risk factor already, right, then you need to do a cardiovascular assessment at a lower age also. For people who are 40 and above, you should get every year, you should get this kind of risk assessment, routinely should be done. For people who are less than 40, 20 to 39 years of age, it's good to have every 4 to 6 years risk factor assessment, whether what is your cardiovascular risk. And if people are even in adults, somebody who is teenagers and has a lot of obesity, other things, high cholesterol, reports are wrong, then you need assessment. Okay. Then let's understand that there is a role of genetics here. There is a role of other diseases here, but that is not in your control. But you can actually learn from them. If you have a family history where your mother, father, or some very close blood relative has had a heart attack less than 55 years of age as a male, or less than 65 years of age as a female, that you have a higher risk of having a heart attack at 5 or 10 years younger than them. So you need assessment way before that, because disease risk will develop over years, many years, sometimes a couple of years, sometimes 10, 20 years, couple of decades. So you need assessment around 30s or 40s. Then some other diseases like genetic issues, genetic primary hypercholesterolemia, metabolic syndrome is a lifestyle issue where your waist circumference is above 90 centimeter point, or 38 inches, or you have high triglyceride, high blood pressure, high glucose, low good cholesterol amount, that is your HDL, which is less than 40. And these are the factors which actually make a diagnosis of metabolic syndrome. That means you have not taken care of your body for a significant amount of time, and now your body has a metabolic issue. There is a syndrome where your body is not able to utilize the amount of sugars and triglyceride, and there is a buildup of all these things, which is a very high risk of having a heart disease if you have any other additional risk factor. Okay, so metabolic syndrome is something which we can easily prevent or reverse, for that matter, if you have that. Now, coming on to kidney disease. So people who have a kidney disease will put additional stress on the heart. People who have other chronic illnesses like psoriasis, lupus, HIV, AIDS, or any other chronic illnesses will have additional stress or additional risk of the heart, but this is not really the most important thing which you need to see. So when we talk about assessment, okay, risk factors, when we have already talked, what are the uh, what are the tests, or what are the risk enhancing factors? So you already have diabetes, obesity, high blood pressure, you take tobacco, you don't exercise. Now, what else can be wrong with me, or what else can be wrong with you? What should you assess? Okay, so in females, if you have premature menopause 40 years before that, or if you have a history of high blood pressure during your pregnancy, preeclampsia, that increases your risk of heart diseases. So you need to correct other things very fast. If you have lipid biomarkers, some South Asian ancestry as ethnicity also has higher risk. But let's talk about important things like biomarkers. Biomarkers, what is this? So persistently elevated hypertriglyceridemia, meaning if your triglyceride levels are very high, that is a very, very important factor. Uh, Persistently elevated. It should be uh, C-reactive protein, that is a high sensitive C-reactive protein, which is continuously high or regularly high more than 2, elevated LPA, lipoprotein A, apoprotein B, these and ABI. These are also a factor. These are types of lipids. ठीक है? If they are high, that means you are not addressing your diet, exercise, and you need to address them. Maybe if they are very high, you need to take medicines to reduce your lipids, because that is something which can be reduced by medicines. It can be reduced with diet and exercise, but then medicines can help, right? Other things like exercise, medicine cannot replace the benefit of exercise. Medicine cannot replace the benefit of diet. They cannot cause instant weight loss. They have to be done by yourself. Sorry. Okay. So, how to correct your lifestyle? How to correct lifestyle factors? Diet emphasis is very important, where for a general idea you need to eat more vegetables and fruits and legumes and nuts and whole grains and fish. Now let's understand here. Right? Now let me ask you a question and think about it. Okay? In the whole day when you eat food, which is the primary thing which is written here: vegetable, fruits, legume, nuts, whole grain, fish, meat, egg, whatever you eat, which is the primary thing you fill your stomach with, right? Which is the most heavy thing, or maybe the most the amount of food which is the largest in your diet, right? If it is grains, if it is chapati, roti, or rice, or something like this, for bread, that is the main thing which you fill your stomach with, then there is an issue. There is a problem, especially if you are overweight. If you're underweight, then fine. If you're overweight, then no. If you're an adult overweight, then no. Then the things which you need to fill your stomach with should go from here: either vegetable, fruit, legumes. Yes, legumes, the pulses, they need to be the one which you fill your stomach with, or the nuts, or then comes the whole grain. Whole grain cannot be the main ingredient in your diet. Fish and non-veg food is also good, but that if you fill your stomach with fish or non-veg, then the amount of fats which you eat will be high, and you have to manage that. Okay, then whatever fats you are taking, there are amount of saturated fat, and you can replace them with monounsaturated and polyunsaturated fats. But most of us don't really know which oil has mono, which has saturated. The idea is that the amount of fat oil, total amount of fat oil, should be as low as possible. As low as you need a little amount of fat, which actually you get from eating whole grains or fruits or legumes. Fruits don't have much, well, legumes will have, nuts will have, whole grains will have, fish will have, egg will have fat, which is enough to give you the amount of fat which you need. And whatever minimum amount of fat you can use for cooking, use it the minimum. Don't eat fried things, don't eat deep fried things. That is the whole idea here. Okay, sometimes if you have it off and on, that is acceptable, but in a limit. Okay, so the this thing, diet containing reduced amount of cholesterol and sodium. How to do that? Reduced amount. That doesn't mean stop eating home cooked food, right? Stop eating, you have to eat, that doesn't mean you have to eat, oil free food or something which is cooked without oil. No, that means you have to stop eating foods which have excess amount of cholesterol or sodium, which is the outside food, which is the processed food, processed meat, processed things, right? Chips and other packaged food, even food bakery food, the biscuits, even one biscuit is not really a healthy food for you. So biscuits, breads, bakeries are not very good because they have a high amount of uh, fats in them. Yes, they use a lot of butter, a lot of ghee, a lot of oils which to cook your things in bakery. So like I said, minimize the intake of processed meat, refined carbohydrate, or sweetened beverages. Right? Even the juices which you take, packaged juices which you take outside, is not good. Refined carbs are not really very good. They're not really a real toxin or something. But the idea is that you should not fill your stomach with refined carbs. That's the idea, right? You should not be having that. I eat a lot of bread. That is what I fill my stomach with, and I eat a lot of bread, a little bit of peanut butter, and a little bit of whatever you are eating. So that is not going to help you get better. The amount of food which you need, the food which you need to use to fill your stomach should be healthy. Okay, a healthy diet needs to be there, and fried things or packaged food can have a lot of trans fats. So reduce that. These are the most harmful fats, trans fats. Try to reduce them as much as possible. Then exercise. What is the exercise recommendation? My exercise recommendation for everybody is they should routinely be reassessing whether or not I'm exercising. First step is that sometimes you go through years of or months after realizing, oh God, I haven't exercised in the last 6 months. There's so many days I didn't exercise. I missed the gym, I missed the exercise, missed the morning routine, and what the hell is happening? My stomach is coming up. Right? So first is you need to reassess, or somebody needs to reassess in a family that okay, we are not exercising, you are not exercising. Okay, pinpointing constructively. And then we need to know at least 150 minutes of exercise every week of moderate intensity is required. Once, not once a week, you need to divide this 150 minutes over 3, 4, 5, or 6 or 7 days. You can do it daily, you can do it twice a week, thrice a week, but 150 minutes per week of moderate intensity exercise. Or if you are still very busy but young, you can do 75 minutes of vigorous intensity exercise, which is going to be in a week, and you will be good. What do you mean by good? That means your heart will be healthier. Okay, any amount of it. If you, and many times people think, okay, I'm not able to complete 150 minutes, I'm not able to complete 75 minutes, then what's the point of exercising? Let's not exercise. I mean, that's not the case. Even 1 minute of exercise every day, 1 minute of exercise every day will help. Okay, will help. If not, if enough, it can help uh, with diet and exercise. So exercise, this is the minimum which you should do, but anything below that also is good. Okay, so to exercise you need to uh, address if you really have a sedentary behavior. What do you mean by that? If you really are a couch potato, or you have to sit all the time in the car, in the office, in at home, and you're always sitting, then that's not really a good thing to do. Then you need to tell yourself, make some reminders, make some alarms after every 2 hours that you need to stand up, take a walk, complete your steps, count your steps. You shouldn't have even if somebody who is completing 75 minutes is not so much, it's just 1.25 hours, it's not very much. If on Sunday you play sports, say you're playing something cricket or something like that, and you think okay, I have done my exercise, and for the entire week you are sitting on the couch, you're not even walking 2000 steps, then you're not healthy. You're not going to be healthy like that. Okay, because it's very important to reassess whether you have a sedentary behavior or not, whether you walk every day. An average amount of person should do 5 to 6000 step every day, even if that person is a housewife, even if you're not going out of the house, even if you're not going out of your room, you should do some steps inside the room. Okay, So it's very, unless you have some kind of fracture or something, okay, unless you are ill, okay, then you should rest. But if you're healthy, you should do 5 6,000 steps every day. If you're not doing that, you have a sedentary behavior. So how to count your steps? You can use your phones. There are hundreds of apps. Google Health, Apple has a health app. So it's a lot of things are available. So sedentary, right? What does that mean? Sedentary behavior. You're always sitting, always reclining, always lying or watching television. That at that time, the amount of work which you're doing, it's calculated in METs. It's a medical term, kind of, which use 1 or 1.5. This is the amount of this is kind of the energy, the oxygen required, used by your body to do that work. Okay, light exercise means when you are just walking slowly, cooking, light household work, which a normal housewife does. In that walking slowly, also you need to complete 5 to 6,000 steps. Okay, for that only that purpose, it's been said from ages that after food you need to walk at home. After food, don't sit down, just stand up and walk for 10 minutes, 5 minutes. Because at least you walk 3 times a day for 15 minutes, you complete 45 minutes of walk, and you can easily complete 5,000 steps in that time, right? So it's a it's important to inculcate small habits in your children, because for you, it's very difficult to start a new habit and break a routine. But for children, it's very easy to make them do something which they can take to their adulthood, right? Then brisk walk. What is a brisk walk? Where you actually do biking, or you do ballroom dancing, biking, jaw, or some kind of recreational swimming. This brisk, and when you actually do jogging. Why we say vigorous? See, a simple way of determining what is vigorous and moderate. In light, and if you're doing light exercise, you'll be able to sing. While people are doing household work or cooking, they are able to sing songs. But if you're doing moderate exercise like dancing and biking, that should be to that intensity where you're not able to sing. If you're not able to sing, you're breaking your breath during singing, then you're doing moderate intensity exercise. But during that moderate intensity, you will be able to talk. Okay, you will be able to talk. You can talk while biking or dancing very easily, because you don't really have to continuously use your breath. You can break. So you're able to talk during moderate intensity. And if you are jogging and you're able to talk, then you're jogging slow in a moderate intensity level. And if you're not able to talk, then it becomes vigorous. Okay, vigorous running or jogging or biking or tennis or swimming laps more than 10 miles per hour, whatever might be the speed, basically you're not able to talk during that time. So this is the idea. So either do some kind of activity like sports where you're not able to talk. So standing for fielding for 1.5 hour doesn't really come into the category of vigorous activity for 75 minutes. Okay. So you need to have that amount of activity, 75 minutes of running, where you're not able to talk. Okay. It's very important. So many of the things which you see here, you can actually make a note of, write down, because something you need to do, right? Everybody has some key areas where they need to work on their own life, and you need to choose which one you are doing wrong the most. Okay, so let's see. On an average, this is the pie diagram which is made for people, that okay, you spend 8 hours or something, 7 to 8 hours, 9 hours sleeping, and you spend doing some light work where you are doing for 7 hours or 8 hours, and again 7 hours you are sedentary and you do 20 minutes of moderate to vigorous exercise every day. This is the average which people want, but obviously this is not going to happen every day. Sometimes you sleep less, sometimes you sleep more, sometimes you do sedentary work more. So it's not good. It's a target thing, kind of. But most important thing which you need to target is here, that you need to do 20 minutes of exercise or 30 minutes of exercise every day. If you're able to do more than that, 60 minutes, very good. If you're able to sleep 7 to 9 hours, very good. These are the two targets which you need to do, and you need to reduce the sedentary time and make sure that you're not sitting for like 4 hours straight, right? More than 2 hours straight. This is the thing. So, other factors. What are the other factors which affect the heart disease? Obviously, obesity does, poor lifestyle does, and where you can actually reduce your calories. Okay, reduce your weight, that will help, obviously. Sorry. BMI is something which is not very ideal to measure the body mass, body fat percentage, because the more amount of muscle you have, your BMI will be high. But still, if you're an obese individual, then this is good to assess your risk. If you're overweight and obese, if your BMI is very high, then you do have a higher risk of heart disease. Same goes with your waist circumference. Waist circumference will vary according to your height and your build, but any waist circumference which is reasonably be more than your expected waist circumference at your age for an adult. If your waist circumference is more than 90 centimeters, it's not really good. Okay, then not good means you need to work on it. Diabetes, we have already we talked about it. You need a good glycemic control. You need to increase your vegetables, fruits, your proteins, and pulses. Then coming on to exercise is also important for diabetes, which we've already seen. Okay, then if it is not controlled, then we have to start medicines. So medicines like diabetes medicine, metformin or other medicines are available, which your doctor will recommend according to your conditions. So there are, you know, there are protocols for treatment of heart disease or prevention of heart disease in your in a diabetes patients, where diet, exercise, aggressive treatment of other risk factors, and then medicines for diabetes. These four things come together to actually treat your diabetes. Okay, it's not just one thing. If your sugar HbA1c is really is less than is more than 8, then the risk is very high. If it is less than 7, then okay, that's very relatively the importance of diet and exercise increases. If it is less than 6.5, then that is something which is the target of the treatment, and less than 6 you should go with the help of diet and exercise. Okay, then you become absolutely okay. You come below the pre-diabetes level 5.7 or below. Okay. Then cholesterol levels. Okay, see, this is, so how far is cholesterol there into risk factors? But cholesterol is there. It's not really the most important step, but it is an important step because this is easily controllable with medicines. But yeah, medicines do have side effects, but diet can really help. LDLC, that is the bad cholesterol, which should be reduced to by less than 30% of more to actually reduce your risk. Basically, it should be less than 100. And if you do have a heart disease, then LDL should be less than 70. Okay. Then coming on to there are recommendations for blood cholesterol levels as far as age is there, and there are indications for statin, that means cholesterol reducing medicine therapy. But that is actually if your LDL levels are very high. For example, if they are more than 190, then or more than 4.9 millimoles per liter, then definitely you need statin or some kind of a therapy. If not for life, if it's not really, statin therapy is never for life, you have to control it over time. So first step is to start the statin therapy, reduce your cholesterol, correct your diet, correct your exercise, and this both of the things will actually prevent the cholesterol from rising again, and then the medicine can be reduced and stopped if you follow the guidelines properly, and if your doctor teaches you what are the guidelines. This is also important. Okay. So blood cholesterol levels, statin therapy will actually reduce your cholesterol levels by 50% or more, and very fast. It does that in 10-15 days. Rather, sometimes when you load, it can do it very quickly also. So then there are people for whom we have to assess whether or not you have uh, a blockage. Okay, because the target of statin therapy or reducing your cholesterol will depend upon how much of a coronary atherosclerotic blockage you already have. For example, if you already have a significant blockage, then the target of statin therapy will become even lower. Then you have to reduce your cholesterol levels, LDL cholesterol less than 70. So the a good test to do that, to assess that, is calcium score test or CT coronary angiography. Calcium score is basically When you have deposits around your blood vessels in your heart or anywhere, over time, your body makes sure that those deposits do not break off and they travel inside your blood and block the other smaller artery. So they have to make sure that the blockage stays there. So basically, they deposit calcium into that block, into that atherosclerotic plaque and make it fixed. This is important from your uh, body's homeostatic purpose point of view. So over time, we can actually check this calcium score, calcium deposit. If there is a lot of calcium, if there is zero calcium, obviously you don't have many blockages, so you don't really need statin therapy. You can reduce statin therapy, stop statin therapy. If your calcium score is less than 100, it's and you are somebody who has a good amount of age, good amount of risk factor, statin can be started. If it is more than 100 or higher, then definitely statins or cholesterol removal medicine should be started. So the even antiplatelets can be started in that case. Okay. So these are the risk, or these are the things which you need to make sure if you really want to prevent heart disease. And there is a lot of guidelines around these factors, and every single patient will have a different set of things, set of risk factors, different set of conditions. In his case, different lipids, different blood pressure, different hsCRP, different lipoproteins, different family history, right? And different risk factors, some different things in your diet. So you cannot do this alone. You have to work with your doctor, you have to work with your family. It's not possible that family people are eating parathas and fried stuff and samosas every day, and you are the only one who is striving, okay, if I get healthy food, then only I can be healthy, but everybody will eat fried. No, you have to correct the family's diet altogether, or else it's just a matter of days, or it's just a matter of, the things will go off plan very, very soon. So this is the basics how you can actually prevent heart disease. Then there are other factors which are not really so important. So I think this is enough for